generating awareness on prevention and mitigation of tobacco-related issues. And I'm happy to inform you all that Diabetes India, which is a trust, not-for-profit trust, and is working in the field of diabetes research, education, and awareness generation since last 5 decades, is working very closely with Government of India on various non-communicable disease issues. And today we take this opportunity to do this CME, which is on this occasion of World No Tobacco Day, which is celebrated every year by WHO to stop the menace of tobacco. And but in pertinently, this year's theme is on protecting children from the industry interference. The reason is close to 37 million people globally who are in this youth age group. They are being lured by the industry into the tobacco menace somehow or the other. And the reason is the tobacco industry needs a replacement of customers because a lot of people die because of tobacco. A lot of people quit tobacco due to health reasons. And a lot of churning happens because of this. And the industry needs to find people on a regular basis to consume their products. So, but this is a very grave issue, and we as a society need to work really hard to protect our children from this menace. And I'm happy to welcome all the dignitaries on the dais. Professor Dr. Anuj Maheshwari, sir, who is a renowned physician and diabetologist, and also chair of the Public Health Advocacy and Education Interest Group within Diabetes India. We also have with us Secretary Diabetes India, Dr. Bansi Sabu, sir, who is also a renowned physician and diabetologist, and also chair-elect for IDF Southeast Asia. And we also have Joint Secretary Dr. Amit Gupta, sir, who is again a renowned physician and diabetologist in Noida, and he's also Vice President of Public Health Group in the American Diabetes Association. So we have great luminaries, great educationists and physicians among us. And today we will use their expertise and knowledge to understand how we as a society should move forward to mitigate tobacco risk. And in this sequence, I would like to invite, first of all, Dr. Anuj Maheshwari, sir, to give us a brief about this problem and how we all started celebrating World No Tobacco Day. What was the background to this and the current theme also? So welcome, sir. Welcome, Dr. Anuj Maheshwari, sir. Please give us this context and background.
Thank you, Nilesh, for the kind introduction, and thank you, Diabetes India, Dr. Bansi Sabu, Dr. S.R. Arvind, and Dr. Amit Gupta for giving this idea to organize this very good advocacy program, and which is very much needed also. In fact, whenever we talk about India, then tobacco is being used in multiple ways. Whenever we talk in the rest of the world, smoking is the largest way of using tobacco. But in India, smoking is not that much used as the other ways of the tobacco use, or I should say abuse, are more popular. And people start them even from their childhood. And we most of the time remain concerned about smoking only, but people use it in the form of the khani, people use it in the form of the pan, people use it in the form of the gutka. So there are multiple ways, and many traditional and regional ways it is differently used. And obviously it is causing a lot of harm. So for the talk context setting to take us the panel discussion move forward, I shall be having few slides to show the importance of the today's program, as well as to to make the people aware about what actually is the importance of today's day, for which the WHO has taken up this day as a No Tobacco Day, and what does it mean here. So World No Tobacco Day is today, 31st May 2021, and we are from the advocacy and awareness campaign launching from the Diabetes India group for the public health and education and advocacy. And this campaign will not be for the day only. We shall try to continue it throughout the year, keeping awareness increase among the people, among the students, among the women, among the pregnant women, for the stopping their tobacco use, whatever form they are using. In 1987, the World Health Organization, which is commonly known as the WHO, passed a resolution that announced April 7, 1988 as World No Smoking Day. But later on, they realized that no smoking is not the all purpose what we really wish to solve. As I already said, in India as well as in other parts of the world, many people use tobacco other than the smoking also. So later on, the act was passed to motivate people to prevent using tobacco for at least 24 hours on the no smoking day. But later on, it was thought that it should be changed from no smoking day to the no tobacco day. In 1988, the same year, the organization passed another resolution that no tobacco day will be observed on May 31st, which is today. Tobacco use is the leading preventable cause of death in world. Currently kills nearly 6 million every year. This will increase to over 8 million every year in a few decades. If current use pattern continue, the death toll from tobacco use will be 2000 to 2025, 150 million. 25 to 2050, it will go up to the double of it at 300 million, and we can see till the end of the century 500 million deaths occurring because of the tobacco abuse. Tobacco could kill up to 1 billion persons in the 21st century unless urgent action is taken. Now question arises, why do people start smoking? Most people who smoke started smoking when they were young or teenager. Those who have friends or the parents who smoke are more likely to start smoking than those who don't. Many of the times, child or when they are in the early age of their life, they see their parents and their friends or their family members are using the smoking and they start using that. Some teenagers say that they just wanted to try it or they thought it was cool to smoke. To avoid tension, anxiety, depression, many a time people start using when they are having the pressure of life, pressure of studies, pressure of job, and they start doing the smoking. Failure in the love life also may become the reason of starting the smoking. Movies showing people smoking are another big influence, and many ways when they see their stars are using the smoking, they start copying them and they try to make them, they try to imitate them in one way or another way. In our old Indian film, it has been seen very commonly. So every time when we smoke in the uh, tobacco, about 70 compounds with confirmed carcinogenic activities are being taken inside of our body. Estimated number of the chemical compounds in cigarette smoke are 7,357, which can harm an individual. Very few people may be knowing about that. And few of them are well known, what we all know about them, like nicotine, nitrosamine, benzene, aromatic amine, acetaldehyde, acrolein, 1,3-butadiene, and polyaromatics. Now, it obviously this is a big carcinogenic reason for in our life when we are using smoking or any way of tobacco. Nicotine addiction, exposure to the toxic chemical, ending up in the form of the cancer, heart disease, oral diseases, tooth loss, erectile dysfunction, and very commonly what we see the effect of the nicotine which causes the vasoconstriction and it ends up in the hypertension, which comes up with so many complications which are very much similar to the diabetes, and ultimately it also becomes the reason of getting diabetes. 90% of all lung cancers can be avoided by eliminating tobacco use. So tobacco use is a big cause of the lung cancer. Apart from that, you can see it here, the oral cancer is one of the more commonly seen entity with the abuses of the tobacco, especially in the form of the canny, especially in the form of the gutka. And of course, smoking is added up, it increases its intensity and severity. Cardiovascular disorders are thought to be caused by lot of smoking is increasing their intensity as well as their they come a bit earlier what they are supposed to be. So if we look for the statistics, 100 million were in the 20th century, tobacco deaths in 20th century, 100 million tobacco deaths were in 20th century, and it is expected to rise up to the 1 billion tobacco deaths in present century. Tobacco kills more than 1 million people each year, and 9.5% of all deaths it is responsible. The most common way tobacco kills is from cardiovascular disease. It becomes a big reason of the heart attack, angina, and other related cardiovascular deaths, apart from various varieties of the cancer. The tobacco is one of the biggest public health threats the world has ever faced, killing more than 8 million people a year around the world. According to WHO, tobacco kills more than 1 million people each year in India, accounting for 9.5% of all deaths. India is home to 12% of the world's smokers. So whatever the number of the world is having of the smokers, out of that 12% lives in India. If we talk about the established fact, 400 deaths per day occurs because of the roadside accident. 1200 deaths per day occurs because of the diarrhea and under 5 reasons in the children. But 3,700 deaths every day occurs because of the tobacco-related reasons. So WHO has introduced an FCTC. This FCTC is the World Health Organization's framework for the Convention on Tobacco Control. It is also known as the FCTC Treaty, which is, some people will call it as the Framework Convention also. 180 countries, those who are the party among this treaty, apart from the 193 countries, those who are the member of the WHO. And they all are bound to follow the provisions of this treaty, which has been entered into the force on 27th February 2005. Overall objective of the FCTC to protect present and future generations from the devastating health, social, environmental, and economic consequences of tobacco consumption and exposure to tobacco smoke, to reduce continually and substantially the prevalence of tobacco use and exposure to tobacco smoke. What could be the solution and how can we really achieve the aim of this treaty? One, we can have the restriction. Sometimes we see that smoking bans, like India had the ban in the smoking at the public places for last many years. In fact, when we were in studies about 25 years, 30 years before, it has started. But at that time, we have not really seen that it could be able to follow it up, but we could see later on that people started following it very well. And it has been implemented very nicely that people are not really found smoking in public places. We can increase the price, we can ban the sales to the minors, and obviously we can create some smoke-free area. We can impart the education at the school level, at the community level, at the home level, and of course we can run mass media campaigns for the same as the Diabetes India is running today. We can restrict the graphic warning labels, ban tobacco advertising, we can ban the promotional actions. So by doing so, we can denormalize the smoking, increase awareness, and de-glamorize the smoking, which can help us in preventing and reducing its use in upcoming generation, adolescent population, which is being attracted seeing their elders using this. If we talk about the smoking condition in physicians or in doctors, here you can see a data which have been presented in 2004, published in 2004, in which it has been seen that physicians, those who smoke, die an average of 10 years younger as compared to those physicians not smoking. The benefits of not taking tobacco are many. Good health, you can prevent the various types of the diseases, family life will be better, avoid dependency in life, live happy life, longer survival, low risk of infection, easier breathing, better quality of life, protection from the respiratory diseases, and lot of improvement in the health you can get you can have an improvement in the health of your family because your many family members are suffering with a passive smoking. You can get rid of the cardiovascular disease, COPD kind of the things, and many other health diseases, oral conditions can be improved or can be avoided if you are not using the tobacco. So this year's resolution is to protect children from tobacco industry interference. What is the meaning of that? Tobacco industry tries to move up. Tobacco industry tries to get more and more business, and by for this purpose they try to glamorize their tobacco use in one way or another. Sometimes they ask the stars to come for their advertisement. Sometimes they do this advertisement. Sometimes they show the scenes of the pictures to the people so that they can be more and more motivated for their product. But ultimately, we have to kept protected our future generation children from all these advertising gimmicks. The important challenge is there for which we are here to discuss how to prevent second-hand smoke or passive smoke. How to help a child exposed towards this glamorizing smoking or glamorizing tobacco use advertisement, and how to treat the effects of smoking if somebody has started using that. And obviously, one has not been written that is most important, that is de-addiction of the generation which has started using the tobacco or smoking. So thank you. Quit smoking is an important which weakens us, which weakens our life. It ruins you and ruins everyone whosoever is that. And today our expertise panel shall be telling us how can we really achieve these aims. Over to Nilesh.
Thanks a lot, sir. Thanks for setting the context and giving us the background behind this World No Tobacco Day and why it is so important to understand the risks associated with tobacco smoking, especially in the children. So, I would again welcome all the panelists, esteemed panelists, Dr. Amit Gupta, sir, Dr. Bansi Sabu, sir, and Dr. Anuj Maheshwari, sir. So, my first question will be to Dr. Bansi Sabu, sir. Sir, can you explain the impact of secondhand smoke on non-smokers, particularly children and pregnant women? What is your opinion around that?
First of all, Nilesh, I must congratulate you for initiating very important topic on a World Tobacco Day. And World Health Organization, creating these awareness day, as Anuj has rightly said, that we cannot, talk only for one day. It is actually throughout the year. And I always tell, whether you are practicing gynecology or you are practicing orthopedic surgery, which is nothing to do with the person to tell that you have to leave you have to quit the tobacco. I think we should all physicians, all the doctors in the community, take a oath that each and every time, whenever you are seeing a patient, we should not miss any opportunity to tell the patient that this is to be stopped, whether it is related to your problem or the treatment, nothing else, because this is something which we as a community, as a doctor, we can do something good for the society. It's not the direct effect of the tobacco which is going to lead and more problem with the cancers and the other cardiovascular disease, but overall quality of life of the patients by quitting it will improve definitely. One more thing which I always say, and that's the government initiative, that they put the tobacco day or the no tobacco use in the movie theater. And there you must have seen that they say that you stop the tobacco because it leads to cancer. They show in the movie also, the person developed the cancer. Even the female also, they show it very positively. But I think we also should try to relate it not only with CVD, but also not only with cancer, but it increases the incidence of cardiovascular disease. As Anuj has shown also in his slides, the cardiovascular disease increase is also very much responsible because of increasing use of tobacco. As you are saying regarding the pediatric age group or the pregnant lady, what I'm seeing in my 30 years of last practicing or in the medicine side, that young children and the females also started increasing use of the tobacco consumption, particularly the smoking part. There is some difference between the western part of the India, as I am from Gujarat and practicing in Gujarat and Rajasthan, where more tobacco users are there in compared to the smoker. When I go to the east part of the country, like in Bengal, or there I am seeing more of a smoker. But now we are also seeing young children and college boys and sometimes school children also. It is not only the tobacco users, but other substance users also increasing throughout the country. The weed and the nicotines, other things are also increasing. And substance abuse is also increasing in our country. So every time, whenever you are seeing a patient, irrespective of their age, irrespective of their gender, whether a female or male, we should ask positive history and we should say that it should be stopped, as it is increasing use in the teenagers and now even in the young children also. The usage is increasing, as you know, people think that it's very cool to take it, and that sort of a awareness we have to create. And once again, uh, Nilesh, who is very active in Diabetes India and this public advocacy group, and Amit and Anuj also, I congratulate both of you and for initiating this wonderful. Thank you.
Thank you, sir. So my next question to now is Dr. Amit Gupta, sir. Sir, in your practice, you have been seeing non-communicable diseases since long. So what do you think, sir, why or how basically is tobacco contributing to all the spectrum of NCDs, which is not limited to, say, CVDs, even diabetes nowadays? Evidence is emerging that tobacco consumption is somehow affecting the increase in prevalence of diabetes and eventually also leading to complications or comorbidities within diabetics as well. And also, obviously, respiratory conditions like COPD and asthma. So what's your take on the subject? How does this tobacco is influencing all these NCDs?
Yes, thank you, Nilesh, for asking that. And again, congratulations for setting this up. As you have asked that, as far as the non-communicable diseases are concerned, we know that the major non-communicable diseases, they are diabetes, obesity, hypertension, the cardiovascular diseases we talk about. And if you look at the diabetes, we know that the smoking or any kind of tobacco can lead to increase in insulin resistance. So increase in insulin resistance again can be a precursor for future dysglycemia, or it can again lead to the worsening of already the glycemic, whatever glycemic control a patient is having. We already know that the blood pressure is again a major thing which can be affected by smoking, and it is just for the all those people who have joined us and those who are not from the medical background. Dr. Anuj Maheshwari is also leading the Asia Pacific Society of Hypertension, and we are also in the world that is a May measurement month. This is the last day of the May measurement month, that is the 31st May. So it is important to note that we tell our patients that we don't even take the blood pressure if somebody has taken nicotine or has smoked 30 minutes before. So such is the impact of the smoke on the blood pressure that it can lead to sudden rise in the blood pressure. So even the blood pressure measurement is not indicated. So what will happen to somebody who is constantly using tobacco or constantly engaged in practices like smoking? We all know that diabetes, cardiovascular disease, they all have an inflammatory milieu as well. So inflammation is again, which is something stimulated by tobacco. So this increases the risk of any kind of heart disease as well, cardiovascular events. You know, the smoking is one of the major risk factors for any type of heart failure, myocardial infarction, or the stroke or the paralysis, paralytic attacks we see. So it has a major impact. It is important to inform people, and I believe many of these people, they are not simply aware that why they are doing this. And proper counseling with proper guidance, I think we can achieve and reduce the uses of the tobacco in our population.
One more thing, Nilesh, which tobacco users or tobacco addicts they have an underlying depression. I mean, we should also take the help of mental health worker or paramedics or clinical psychologist or sometimes psychiatrist also. Because any sort of a addiction is a indirect evidence of some sort of a endogenous depression, and they need some psychological counseling or psychiatrist counseling for their quit also. I mean, otherwise it's really difficult. I normally do one more thing in my practice, because some of the patients must be promising you, sir, I will live. And this is very common when a physician asks or a doctor is asking his patients that you have to stop it, or You have to leave the tobacco. So they always say, yes, sir, I will do it. But I always say, okay, you write it on your prescription. I have written the prescription. Now you write it that, yes, I am going to leave tobacco by end of this month. So I mean, from 1st of June, I am going to leave it. And this you have to sign that 1st June 2024. I'm going to leave it forever. So by writing, it's like your commitment. It's like, and that will also keep on reminding them if they will be leaving, because in front of the doctors, they have promised and they have written it also with the signature. So this is a very common sort of a signature. Why I'm sharing with everyone that, we physicians, we can use this. And many of the times I see, but I tell every day, like more than 30, 40 patients, maybe in a day, to stop it. And maybe even if it works for one patient, we are doing great job for the society. So everyone should try for it.
Thank you, sir. Very pertinent point. And in fact, my next question was linked to the same topic. So next question is for you, Dr. Anuj Maheshwari, sir. एंड हमारे काफी सारी ऑडियंस नॉन मेडिकल बैकग्राउंड से भी हैं, तो एक सवाल मतलब थोड़ा सा आई विल कीप ऑन मिक्सिंग हिंदी एंड इंग्लिश इन बिटवीन. तो सर ये सवाल इस तरीके का है कि जो लोग आदी हो जाते हैं तंबाकू सेवन के या सिगरेट स्मोकिंग के, तो उनके और उनके परिवार वालों पे, उनके मानसिक मनोदशा पे क्या प्रतिकूल प्रभाव पड़ सकते हैं बिकॉज ऑफ टोबैको एडिक्शन. तो इस पे से थोड़ा प्रकाश डालेंगे तो अच्छा रहेगा हमारे ऑडियंस के लिए.
जैसे जैसे अभी हम लोगों की जानकारी बढ़ती जा रही है स्मोकिंग के बारे में और उसके बैड इफेक्ट के बारे में, तो आजकल परिवार बहुत ज्यादा कॉन्शियस हो जाते हैं. अभी वो पैसिव स्मोकिंग के लिए बड़ा केयरफुल रहते हैं कि खासतौर से जो स्मोक करता है वो भी ये सोचता है कि मैं जब स्मोक करूं तो मेरा कोई फैमिली मेंबर मेरे साथ में ना बैठा हो, सो दैट ही और शी में नॉट गेट द पैसिव. पर पहले ऐसा नहीं था. पहले लोगों को इतनी जानकारी नहीं होती थी और लोग कहीं पर भी किसी भी जगह खड़े होकर के स्मोकिंग करते रहते. At that time, psychological problems were not that much involved as they are today. Because once they are having in the feeling of guilt, and guilt is not only from the person who is smoking, but also towards the family members also. And they are feared for some unknown disease. If I am sitting with him, I may get some respiratory disorder, I may get some oral cancer, something like that. And that is causing a lot of psychological ailments among the families nowadays. So more information about the smoking has also increased a lot of tension, a lot of psychological issues among the families. Apart from that, this is a vicious cycle. What happens? A person remains in the tension, he starts doing the smoking. And once he starts doing the smoking, he gets addicted of this. And addiction brings the psychological disorder again. So psychological disorder leads to the smoking leads to the addiction, and addiction is again one of the variety of the psychological disorder which leads again the same antipsychotic treatment what the patient was requiring on that. So obviously it becomes a bigger problem for the psychiatrist as compared to the physician. And obviously physician has to handle when the person will be coming up in towards the heart disease or hypertension, as Amit well very rightly explained, that whenever a person starts doing the smoking, his vasoconstriction takes place, and that vasoconstriction leads to the hypertension. And the same thing happens in the pregnancy also. It reduces the flow which is going from the mother to the fetus, and because of this vasoconstriction. And what happens? IUGR. IUGR is the very common. IUGR means बच्चे का साइज कम पैदा होना, माने उसका इंट्रा यूट्राइन ग्रोथ रिटार्डेशन, उसके प्रेगनेंसी के दौरान बच्चे की साइज कम हो. तो ये स्मोकिंग करने वाले लोगों को काफी ज्यादा ये प्रॉब्लम फेस करनी पड़ती है प्रेगनेंसी के दौरान. तो अगेन फिर ये साइकोलॉजिकल प्रॉब्लम्स को जन्म देता है, क्योंकि जब परिवार में इस तरह की चीजें होती हैं तो फिर झगड़े होते हैं कि भाई स्मोकिंग मत करो, मेरे सामने बैठ के मत करो, घर से बाहर निकल जा रहा हूँ मैं, ये कर. तो लॉट ऑफ थिंग्स, क्योंकि बहुत सारे लोग इस तरीके के दिखाई देते हैं आसपास, तो ये चीजें हमेशा साइकोलॉजिकल प्रॉब्लम्स को जन्म देती रहती है.
बहुत बहुत धन्यवाद सर. और ये बिल्कुल सही बात है कि मतलब सिर्फ जो तंबाकू सेवन कर रहा है वो नहीं, अपितु पूरा परिवार उसका जो है वो एक तरह से पीड़ित हो जाता है. भले ही वो सीधे तौर पे तंबाकू सेवन ना कर रहा हो, पर जो मानसिक विकार हैं, जो गिल्ट फीलिंग है या जो एक सेंस ऑफ कहा जाए कि थ्रेट फील करती है फैमिली की, इनकेस तंबाकू सेवन से हमें ना दिक्कत हो जाए, और इसके अराउंड वो चाहती है कि उनका परिवार का सदस्य वो क्विट करे, और क्विट भी नहीं कर पाता है, तो एक काफी विकट स्थिति पैदा हो जाती है परिवार के लिए, और काफी फ्रिक्शन को या आपसी टकराव को भी पैदा करने वाली स्थिति बन जाती है। तो बहुत बहुत धन्यवाद सर। अब अगला सवाल मेरा डॉक्टर बंसी साहू सर आपसे है कि आप सर सेक्रेटरी भी हैं डायबिटीज इंडिया के, तो आप सर क्या रोल देखते हैं डायबिटीज इंडिया का एज एन ऑर्गेनाइजेशन इस पूरे क्या कहते हैं माहौल में, जहाँ पे ये अभी जो इस साल का थीम भी है कि हमें बच्चों को बचाना है, एंड बीइंग एन नॉन फॉर प्रॉफिट ट्रस्ट वर्किंग इन द फील्ड ऑफ डायबिटीज सिंस लॉन्ग, आप कैसे डायबिटीज इंडिया का रोल देखते हैं इस पूरे पब्लिक हेल्थ कैंपेन में?
तो पहले तो कोई भी organization, and our organization is a medical organization. So I mean, if a medical organization or anything which is related to any medical awareness, so we say no tobacco. It may not be or may be related with directly with diabetes, but tobacco use and diabetes का तो बहुत I will say काफी interlinked है, because diabetic patients में यदि tobacco user है, तो आप समझिए कार्डियोवास्कुलर रिस्क बहुत इंक्रीज हो जाती है। हम जब ASCVD रिस्क कैलकुलेशन करते हैं तो वन ऑफ द इम्पोर्टेंट थिंग इज द कैलकुलेटिंग द रिस्क विद फैमिली हिस्ट्री, डिसलिपिडीमिया एंड आपको स्मोकिंग की हिस्ट्री। इसके अलावा भी आपने देखा होगा स्टेनो 2 ट्रायल का जो डेटा था उसके अंदर हमारे को ABC यानी दैट A1C ब्लड प्रेशर और कोलेस्ट्रॉल कंट्रोल के साथ में जो चौथी बड़ी इंपॉर्टेंट चीज थी वो स्मोकिंग सिजेशन था, जो उनकी लॉन्ग टर्म सर्वाइवल के लिए इंपॉर्टेंट था कि दोज पेशेंट्स हु कुड स्मोकिंग का स्टॉप हुआ। क्योंकि ये सारी चीजें मॉडिफाइबल फैक्टर है। आप शुगर कंट्रोल कर सकते हो, आप ब्लड प्रेशर कंट्रोल कर सकते हो, आप कोलेस्ट्रॉल कंट्रोल कर सकते हो, और आप स्मोकिंग छुड़ा सकते हो। देयर आर नॉन मॉडिफाइबल रिस्क फैक्टर्स लाइक फैमिली हिस्ट्री। इसलिए एज ए ऑर्गेनाइजेशन हमारा कैंपेन, और आई वुड लव टू बी द पार्ट ऑफ दैट कैंपेन एज ए डायबिटीज इंडिया, the national campaign with IMA or with other organization, the national campaign for no tobacco, or we should stop using the tobacco. And in India के अंदर डायबिटीज की प्रैक्टिस करने वाले नहीं करते 40 से 50 हजार फिजिशियन जो एक्टिवली रोल करते हैं। तो मेरे को लगता है कि यदि हम सब लोग इसको और जुड़े तो इस कैंपेन को काफी हद तक हम क्विट करा सकते हैं। ओनली थिंग इज कि बहुत लाइटली जो कहते हैं कि आप तंबाकू बंद कर दीजिए या आप स्मोकिंग बंद कर दीजिए, उतने लाइटली कहने से वो हमारा काम पूरा नहीं होता। इसको बड़े अक्षर के अंदर कैपिटल लेटर के अंदर लिखना है कि पहले तो उनकी रिस्क के बारे में लिखना है, उसको रिस्क समझाना है, उसको कैपिटल लेटर में लिखना है कि आपको बंद करनी है, उसके फैमिली मेंबर्स को समझाना है, जरूरी लगती है तो क्लिनिकल साइकोलॉजिस्ट को या साइकियाट्रिस्ट को उनको रिफर करना है, और उनसे खुद से एक ऑथ लगानी है या उनसे प्रॉमिस लगानी है, एक प्रॉमिसरी नोट पर साइन करानी है कि मेरे को आज से बंद करनी है। यदि एक डॉक्टर 2 मिनट ज्यादा देता है इसी चीज पर ध्यान, तो आई एम श्योर कि इट इज गुड। जैसे हम डायबिटीज डॉक्टर अभी ट्रीटमेंट के अंदर हम ओबेसिटी के बारे में बात करते हैं, ब्लड प्रेशर के बारे में बात करते हैं, कोलेस्ट्रॉल के बारे में बात करते हैं, और स्ट्रॉन्ग एविडेंस भी है कि स्मोकिंग छुड़ाने से या टोबैको छुड़ाने से उनकी कार्डियोवास्कुलर डिजीज कम होती है। तो मेरा डॉक्टरों के खास आह्वान है कि आप इसके लिए जरा 1-2 मिनट ज्यादा दीजिए, समय ज्यादा दीजिए और पेशेंट को समझाइए। जरूर से हो सकता है 10 में से 1 को फायदा हो, लेकिन वो एक भी बहुत बड़ा बेनिफिट होगा समाज के लिए।
बहुत बहुत धन्यवाद सर। नेक्स्ट क्वेश्चन इज फॉर यू डॉक्टर अमित गुप्ता सर कि सो इन दिस करंट कॉन्टेक्स्ट you will be realizing that a lot of youth who are being targeted is mostly because of predatory advertisements and all those issues, and because of over hyperness on behalf of the industry as well. And a lot of times these are beyond our scope as a physician or even as a community. How do you think the role of national health government coming into play, and what national policies should be made in this regard, which can be of some help for the country?
I think Nilesh, you have asked the right question, and you know that a lot of time the youth simply takes up to smoking or any kind of addiction because of the peer pressure, and because of the peer pressure as well as the fancy advertisements which are done around, like Juba, something like that, and I will say it is not Juba something, it is Juba Canceri. So people should be aware that they should not fall into the traps of these false advertisements, and giving the right information at the right age is very, very important, because by the time you tell these people and they are already, because a lot of youth, as you see that the theme of this year is focus on the youth. So a lot of youth, they always almost take up the smoking or something like that, or tobacco, by the age of 10 to 15 years. So giving them the right information before that age, and before that, people, they don't talk about all these things to the youth because they believe it is something that should not be spoken to the youth, or there is a taboo around that. But the people actually, they start smoking at this tender age of around 10 to 15 years. So it is important that we send the right communication at this point of time. The school health programs, they are very important. The educational institutes, they must have a very strict no tobacco policy. No tobacco should be allowed at the campus. And one important thing which Dr. Anuj Maheshwari also highlighted, that we can see this difference at least in the public places now. The people who smoke in the public places are not very much, and people are more aware, and they will always look for some places which are designated for smoking, but they will not smoke in the public places. Earlier, if you remember our days, and this has happened only because of the policies of the government, because the constant awareness they created, and the people, they recognize that it is important that their smoking is dangerous not only for them but also for the surroundings. So one thing is that constant education, and second thing is development of the right education material. Now I think the difference between the 20 years before and now is that we are living in the era of the social media, where it is very easy to reach the masses through the different agencies or different campaigns. Maybe the government also tries its level best, and they have different social media handles which keep on pushing the content regarding the public health and the awareness. And the role of the organization is that we should constantly talk about it. We should not miss any opportunity to talk about whenever whether it is smoking or any other health hazard. So I think, and leaders like you, Dr. Anuj Maheshwari, Dr. Bansi, they can help in giving the government right input so that they can come up with the right policies. Especially the key important thing is that here the advertisements and even the celebrities like Bollywood stars, they should also take some responsibility. They should not simply run for the money whenever they are advertising for the tobacco products, because it has a major influence on the mind of the young generation.
But Nilesh, one thing that government had already stopped advertising. I mean, it is not allowed to advertise in any form of tobacco on any public or TV or channel or social media or newspaper. Now, indirectly, they are doing it for mouth refreshment, not as a tobacco. That the product which they are trying to show is also like a mouth refresher, not for as a tobacco chewer. And indirectly, they have the same product with the name of tobacco also. So these are the some of the indirect advantage. But that people also should think that this is when the government is doing so much, and when they can't advertise something which is directly, even they are writing on the packet of smoking or on the tobacco, it can lead to cancer. So they show the photo also. It is in the size of the box is this much, and out of that 40% to 60% is written on that it can kill you. And similarly, everywhere, even there is a separate or designated area for smoking. Outside that, it is written that no smoking should be stopped, or no smoking, or smoking can kill you. All those things are there. So I think it needs more social awareness, and for a period of time, one side we are seeing there is a increasing awareness, but other side we are also seeing that a lot of new people also started taking it up. So there is some challenge how to deal with it. I think as a doctor, I feel that my responsibility is always that I ask the patient, I initiate this discussion about the tobacco and smoking, and I make sure that I give proper advice to stop it.
Thank you, sir. One of the other important points where I think that has been worked wonderful for the country as well has been rising of taxes on the tobacco products. So that is one aspect where Government of India has done really wonderful. And as part of FCTC convention, this has been.
I think one more delay, I have written 2-3 times before also previously, that increasing tax on the sugary beverages or on the tobacco products. But government has to also write that why they are doing it. It's not for the purpose of increasing revenue for the government. It is primary purpose is to stop these products. That's the whole idea. But they are not advertising. They are not showing that they are increasing the cost of these products. It shows indirectly people think the cigarette महंगा हो गया. You know, next day न्यूज के अंदर ऐसा आता है. और तंबाकू खाना सेवन के लिए खराब ऐसा नहीं लिखा जाता. तंबाकू खाना महंगा हो गया. You know, that sort of a media right on the next day news after the budget. So it should not happen like that. Indirectly they should show कि गवर्नमेंट ने प्राइमरी इनिशिएटिव लिया है हेल्थ इंडिया की सुधारने के लिए, और इसके लिए इस चीज को महंगा किया जाए. सामने आपको रसोई की गैस सस्ती की जा रही है, या आपके लिए डीजल सस्ता हो रहा है, या आपके लिए कपड़ा सस्ता हो रहा है, या आपके लिए और चीज सस्ती हो रही है, लेकिन ये चीज महंगी कर रहे हैं क्योंकि ये एसेंशियल नहीं है और इसको हमको कम करना है. तो ऐसा साइमल्टेनियसली एडवर्टाइजमेंट होना चाहिए, नहीं तो लोगों को पता ही नहीं चलता कि ये महंगा हुआ है, उसका पर्पस क्या है. बिकॉज दे फील दैट गवर्नमेंट वांट्स टू टेक मोर मनी आउट ऑफ.
At the same time, sir, I would like to just ask the panelists, there are some states where the alcohol is banned completely. I don't think there is any single state where tobacco is banned completely. So, why such steps cannot be taken? And when it comes to tobacco,
I
when alcohol
agree,
can be
I mean, there
banned
is
in a
no
state.
reason that why alcohol is banned or why other things are not. So, I mean, there are so many, and many things are banned in India. It's not just tobacco. We can't talk about, I mean, alcohol. There are many more things also banned.
No, this is a very valid point. I agree with Amit that no state is there in India which has banned smoking, although smoking is
No
highly
city,
injurious. No
no
city.
town, no even a mohalla is stopped with that. You can say that.
And
एक घर ऐसा नहीं है कि जो अपने बाहर, इवन आप अपने घर के बाहर ऐसा नहीं लिख सकते कि मेरे घर में कोई आए हुए मेहमान को आई एम नॉट अलाउइंग. यदि आपके घर आके कोई पीने लगता है तो आप उसको ज्यादा से ज्यादा आप ये कह सकते हैं कि सर आप गार्डन में बाहर पी लीजिए या बालकनी में खड़े होकर पी लीजिए. लेकिन आप ये हिम्मत कर पाएंगे कि आप ये कहेंगे कि नहीं साहब हमारे घर में अलाउड नहीं है, आप नहीं ले सकते. जबकि अपने कई घरों में ऐसा अलाउड है. आप नॉन वेज किसी को अलाउ करेंगे घर में? नहीं करेंगे यदि हम प्योर वेजिटेरियन है. हम किसी को अल्कोहल अलाउ करेंगे यदि हमारे घर के अंदर अल्कोहल हम नहीं लेते हैं तो ऐसा. लेकिन किसी की हिम्मत नहीं है. इट इज लाइक कस्टमर, ठीक है ले लीजिए आप. तंबाकू मसाला तो अपने सामने ही बैठ के खा रहे हैं, तो वो भी हमारे को कंपेयर बंद करना चाहिए.
यस आई एग्री विद. हम लोग को अपने घरों में भी ऐसे नियम बनाने चाहिए कि घर में कोई
हम
आ रहा है
घर
तो
का
उसे
कोई मेहमान को भी हम तंबाकू मसाला अपने घर
तम्बाकू
में नहीं
घर के
खाना.
अंदर जब तक है तब तम्बाकू ना खाए.
शादी ब्याह के अंदर भी जब हम पान रखते हैं, हमने बीच में अपने जैसे मैत्री समाज की उनकी कई शादियों के फंक्शन के लिए जो रूल बना रहे थे, तो उसमें मैंने बोला था, उन्होंने क्या होता है कि 15 ही फूड के आइटम रखने हैं, 11 ही रखने हैं, 20 रखने हैं. तो मैंने कहा जब आप पान रखते हो तो वहां पर आप कम से कम तंबाकू वाला पान अलाउ. हम इसको एज ए माउथ रिफ्रेशनर अलाउ करेंगे, लेकिन आप वो बंद कर दीजिए. आप पान वाले को कहिए कि हम तंबाकू वाला पान. तो ऐसी सब चीजें पब्लिक जगह के ऊपर जब तक कोई इनिशिएटिव नहीं लेगा तब तक नहीं. और आई थिंक जिस भी ऐसी कोई भी कमिटी में डॉक्टर हो तो उसको ये इनिशिएटिव जरूर से लेना चाहिए, जैसे मैंने हमारे यहाँ पर लिया है. और हमारे मैत्री समाज का जो साल के 4 फंक्शन होते हैं, दिवाली, होली, गेट टुगेदर के अलावा अपनी महेश नवी, उसके अंदर जो हम पान डिस्ट्रीब्यूट किया जाता है, उस पान के अंदर वो पान तंबाकू वाला. वहां पर आप पान खाते हो तो आपको तंबाकू वाला, दैट इज फिक्स. तो कम से कम वो हजारों लोगों को, और वो लिखते हैं स्पेसिफिक कि भाई यहाँ तंबाकू का पान खाना मना है, सेहत के लिए हानिकारक.
One of the
इसमें
major
हम लोग
challenges.
एक अमित एक चीज और हम लोग कर सकते हैं डायबिटीज इंडिया की तरफ से. डॉक्टर बंसी साबू एंड डॉक्टर अरविंद आप लोग लिख करके भेज सकते हैं सारी गवर्नमेंट को कि tobacco ban is more important than alcohol ban. So if you have done the ban of alcohol, it is very good, but you must try to make it the ban of the tobacco also.
So Anuj, we all can write. I mean, you are from the advocacy committee, and Nilesh is also there for public health and advocacy. So we can write, and we should write it to the government. In between,
I
we
will
should-
just share one example from today itself. Just before I was planning for this webinar, there was a patient in my chamber, and his blood sugar was haywire. So I asked him to do so many things and counseled him that you don't take tobacco at all. The first thing the patient did, sitting in the waiting area, he opened his pouch and was. I went after him and told him that at least don't you consume tobacco inside the clinic or inside the hospital premises. This is how deep ingrained is the. So how to go for the
But
de-addiction?
sometimes, unluckily, some of the doctors are also confused. That's also, creating a bad impression for the society. So if you know the person who is supposed to advise the people to stop it, if they consume that too publicly, creates really wrong impression in the society.
Thank you, sir. Just to give an update, Telangana is the first state to ban sale of tambaku, gutka, and pan masala. So while smoking is not banned, but tambaku and gutka
No,
products
but
are
still,
banned
I mean, the
1
in
year starting
combination,
from
the
24.
gutka is stopped across the country. Now you can't have the gutka. Gutka means the pre-mixed tambaku with that.
Right.
Now they have to consume two separate things. One is the whatever the supari or that idea, and the other is your tobacco. So two separate. Before that, it used to come in a one pre-mixed formulation. So like premix is also decreasing in our diabetic patient. The same way
Right.
the premix is now getting stopped here also.
So moving on from here to next question, डॉक्टर अनुज माहेश्वरी सर आपसे एक सवाल ये है कि जो यूथ की एज होती है, जो टीन्स एंड अर्ली टीन्स होते हैं, ये थोड़े से विद्रोही स्वभाव के भी होते हैं, मतलब नया नया जोश होता है, हार्मोनल चेंजेस भी हो रहे होते हैं, एंड थोड़ा सा अपने पेरेंट्स की भी कम सुनते हैं। तो इस ऐसे माहौल में पेरेंट्स का क्या रोल होना चाहिए या गार्जियंस का क्या रोल होना चाहिए, कैसे डायरेक्शन दे सकते हैं वो अपने बच्चों को इस प्रॉब्लम से बचे रहने के लिए?
लोग यहाँ एक भारतीय परिवारों में एक चीज होती है, संस्कार। और संस्कार हम लोगों के यहाँ जो दिए जाते हैं वो बहुत बचपन से दिए जाते हैं। जो जो जब बच्चा 1 साल का होता है उसके बाद से ही थोड़ा बहुत भी समझना शुरू हो जाता है। तो वहां से अगर हम बच्चे के मन में ये बात बैठाना शुरू कर दें कि ये चीजें बुरी हैं, तो वो शायद आगे चल करके उनकी तरफ नहीं आकर्षित हो। खैर ये हो नहीं पाता। अब आजकल टीवी वाला एटमॉस्फेयर है, राउंड द क्लॉक हमारे पास सोशल मीडिया है, राउंड द क्लॉक हमारे पास टेलीविजन है, जिसमें कुछ ना कुछ इस तरीके की चीज आती रहती है जो हमारे संस्कारों को नलीफाई करती रहती है। जितना भी हम लोग बच्चों को सिखाते हैं वो सारा वेस्ट होता जाता है, बिकॉज दे स्टार्ट लर्निंग द अदर साइड ऑफ द इंफॉर्मेशन ऑल्सो। तो ये एक बहुत बड़ा चैलेंज है, जिसके लिए हम लोगों को सिर्फ ये एक पेरेंट्स यही कर सकते हैं कि अपने साइड की इंफॉर्मेशन को बहुत अच्छे से और से ज्यादा जोरदार ढंग से बच्चों को बताते रहें, कहते रहें कि बेटा ये बुरा है, ऐसा नहीं करना है। जैसे हमारे परिवारों में क्या होता है कि लड़कियों को बहुत कुछ सिखाया जाता है बचपन से। जब वो पैदा होती हैं उसके बाद से जैसी समझ आती है कि बेटा बाहर जाते समय ये करना है, ये नहीं करना है, ऐसा करना है, वैसा। हम ये सब चीजें लड़कों को क्यों नहीं सिखाते कि स्मोकिंग नहीं करना, कि अल्कोहल नहीं लेना, कि बाहर जाते समय किसी से ऊंची आवाज में बात नहीं करना, कि अपोजिट सेक्स की रेस्पेक्ट करना, अपने एल्डर्स की रेस्पेक्ट करना। दीज आर द थिंग्स विच विल मेक ए गुड सोसाइटी, ए गुड फैमिली। एंड हमारा कहीं स्मोकिंग सेसेशन भी इसी में से कहीं से निकल करके आता है, क्योंकि इसके लिए हम कुछ और एडिशनल कुछ कोई ऐसी गोली नहीं है जो हम अपने बच्चों को खिला दें और स्मोकिंग ना लें वो। तो हमारे पास यही एक तरीका है कि हम इस तरीके से ही स्मोकिंग के अगेंस्ट उनके मन में अपने विचार रखें कि वो स्मोकिंग की तरफ ध्यान ना दें। बहुत सारी कम्युनिटीज में अल्कोहल अलाउड नहीं होता, तो वो बचपन से ही अपने बच्चों को इस तरीके से ट्रेन करते हैं कि वो बड़े होकर के भी अल्कोहल की तरफ आकर्षित नहीं हो। तो जब वो ऐसा कर सकते हैं तो हम ये ऐसा क्यों नहीं कर सकते कि अपने बच्चों को इस तरीके से बड़ा करें कि वो स्मोकिंग या टोबैको प्रोडक्ट की तरफ ना आकर्षित हो और उनकी तरफ उनका ज्यादा ध्यान ना जाए।
ठीक है सर, बहुत बहुत धन्यवाद। एंड नाउ कमिंग बैक टू यू डॉक्टर अवंती साहू सर, you are also a health technology enthusiast and founder of DTech as well. So what role do you see of technology and digital tools in combating tobacco and mitigating its effect?
So one of
Lot
the
of role.
technology use which we are doing here, we all four sitting from different parts of the country and talking each other and on a public forum and trying to increase the awareness on a social media. So that's one of the biggest use of technology, now reaching out to thousands of people, or maybe tomorrow if our social media account will be tagged or by followed by, then it can be even lakhs of people can follow you. So I mean, one of the biggest use of technology that you can use, or you can reach out to the people who are otherwise not listening, the doctors, or they don't, the experts like Anuj and Amit and you, and how we can reach out. So that's one of the biggest use of the technology. The other is that, we are using telemedicine. So again, in the telemedicine, they are very specific. Like suppose patient had called you only for the sugar, only for the purpose of blood pressure, or maybe for one of the reports. So we forget to take a complete everything, all the aspects, like when you are sitting in front of the patient. There are in telemedicine some of the things you may miss. Yes, definitely clinical examination you are missing. But I think in detailed history, in that telemedicine, that's a very important technology which we are using now, and it is official also. You can write a prescription there also. The third thing, we can also ask there are EMR system and there are telemedicine EMR. We have to ask that how many doctors in their prescription, they put it rightly that no smoking, whether it's in telemedicine or a physical. So are they writing it very specifically? Because it's a therapy. It's your RX. It's like treatment. The way we are now prescribing diet, we have to have an exercise prescription. That's what I do in my practice. There is an exercise prescription. And the same way, we have to write about the tobacco situation if somebody is consuming. And in history also, you have to write in detail that how many cigarettes in a day and how many tobacco packets one is consuming. So that is also very important. So in technology, we have to, one side, we have to take the data, which is to be taken properly. So that will help us that how many people are really consuming it. That's number one. The second is, with this data, we will able to generate tomorrow a AI-based system also. So, if you have a data, because the data will give you the deep machine learning and through which only AI can come. So, in any patients, if they put the history of smoking, they get the immediate information, or they get repeatedly some sort of a message or something which we can create through AI system, that your patient will continue to get some sort of a motivational message to stop all these things. So that's a second part. And there are some of the apps which are available, like for diet control, for weight reduction, for reversal of diabetes, or for control of diabetes. There also it can help, because with the app, if there is a system, as they are already, a mental coach is there, mental health coach is there for the patient to increase their compliance for medication or for the diet. Simultaneously, they also talk about the smoking cessation to be stopped. So, I mean, there can be uses of technology to decrease consumption of tobacco or stop consumption of tobacco or tobacco products for the patients.
Thank you very much, sir. And now the last question for you, Dr. Amit, sir. In the constraints of our own practice, we physicians and doctors, we have very limited resources. And many doctors don't even have a staff as well. So how do you think, what role can a single doctor sitting in his own chamber can play in this whole panacea of tobacco control?
I think, as rightly pointed out by Dr. Bansi as well as Dr. Manishwari, we should talk about the health hazards of smoking, because this is the best information which we can give to our patients. We can tell them what will be the benefit if they discontinue to smoke. And this alone is not going to help. We need to ask them constantly, almost at every visit. We need to identify the challenges. If somebody is willing to give up the smoking or the tobacco, why they are not able to do so? What are the challenges they are facing? Are they getting some kind of withdrawal symptoms? Is there a lack of desire? Is there a lack of social support? Is there a lack of family support? So we need to identify the right cause, that what is not helping them. We are able to identify the right cause. We can do the counseling. We can talk about the behavior therapy. We can talk about the behavior modification. And at the same time, it is important that now there are smoking cessation therapies also. There are tobacco cessation therapies also. So there is no harm in taking help from a qualified practitioner or a qualified doctor to understand that how to give up these habits if you are not able to do so. And the team approach is always helpful. If I don't have a time, then I can always ask the patient or refer the patient to a colleague who is actually doing this work. So we should not be afraid of sending our patient to people who are helping our patients to give up smoking and all. This is my take on this, and I think every time we should not lose hope. We should continue to talk about the menace of tobacco and motivate our patients to give up this habit.
Thank you very much, sir. Now I would just like to check for any audience questions. Open house, anybody has any questions? Sagar, can you please help us with this?
No, sir, we don't have any comments.
Okay, thank you very much. So now I would like to request Dr. Anuj Maheshwari sir to please conclude this and give your conclusion remarks.
Yes, thank you, Nilesh. This has been a really very fruitful discussion today, and many things come out from this discussion which were not really in our ideas, in our thoughts earlier. Like one important thing, how to prevent kids from developing the habit of smoking or using tobacco. How can we really start thinking about banning of tobacco and tobacco products in country, as we have already seen the ban on the liquor in few of the states in our country. Third thing, we should write to the government for taking these kinds of measures. Already Indian government is very much proactive as far as the smoking and tobacco products are concerned, because we are the first nation across the world which has banned the smoking advertisement from the social media and in even in movies and film also. Because none of the, not neither in Hollywood or neither in any other country, I have seen that smoking scenes are banned in the pictures. So this has been a great effort which has been taken by Government of India. In fact, the country which was in the shape in developing at that time when it has been banned doing the smoking at public place, which was also a big step, I believe that, because a country like India where everyone was being attracted towards the king. Every mazdoor, every labor, every rickshaw wala, every pan wala is using that bidi, smoking, and multiple other things of the tobacco. So it was really a bit tough to make it ban at the public place. But we should also make the ban of tobacco use at the public place. We have banned the smoking at the public place, but we did not ban the other products of the tobacco at the public place. They should also be banned, and then it would be reaching to the complete. So obviously, two, three new messages has come out of this discussion of the day, and we should continue this drive throughout the year and keep on promotion of no tobacco. Should not be only 31st May, it should be every day no tobacco day.
Thank you very much, sir. Thank you all the panelists, and thank you all the audiences for joining in this CME on No Tobacco Day by Diabetes India. And I'm very thankful to RX Events also who helped us organize this CME. So once again, thank you all of you. Thank you.
Thank you.
Bye-bye.
Bye.